Well, Mike Gibson and Will Gibson here. We're talking about a new target for cancer therapy. Will, there was just an article in the New England Journal. They rarely publish phase one results, but they did publish the results of a phase one trial targeting p53. What is p53? What do we know about it, and why is it such an undruggable but important target? Undruggable to this point, I should say.
Yeah, I think that's a great place to start it, which is that the history is really important here. P53 was amongst the first alterations discovered in cancer genomes 45 years ago. And up until this moment, we've had really no meaningful treatments addressing P53 mutations directly. So it is odd to have a phase one with a 20% response rate published in the New England Journal, but the reason here is that this was such an immovable target, affecting more than 5 million patients yearly, causing 5 million deaths per year. So while this is just one part of p53, I think that it signals something that we're finally making progress here.
Now, if we look back in biology, there are some animals that really don't get much in the way of cancer. I think like elephants are one of them. Do they have a lot of copies of p53? What do we know about the biology of this target?
Yeah, so p53 is often called the guardian of the genome. What it does is it's a transcription factor that responds to all sorts of cellular stresses and then kicks off either cell cycle arrest or the cells to commit apoptosis and kill themselves. And it's cancer's favorite trick is to disable p53, disabled in the majority of cancers by one way or another. And so I think for a long time we've struggled with how do we drug something where there's an absence of a function, the absence of a tumor suppressor. And what this study did is that it was looking at whether you can restore p53 function. What you mentioned about elephants is correct, which is that nature always finds the right toggles for these problems, and so elephants duplicated the p53 gene 20 times to protect themselves from cancer.
So it looks like it is druggable. It looks like it is a viable target. This is probably the first shot on goal. Talk to us a little bit about your research in this area and what you see as the future.
Yeah, so what's happened in this situation is there's a drug here that binds to the Y220C mutation of p53. So there's this little cleft that opens up with this mutation, and a small molecule that PMV Pharma engineered sticks in and stabilizes it, allowing p53 to refold. And in the past, there's been lots of reported refolders, but none of them were actually real. This one is real though, and we're seeing real target engagement and mechanism in patients. We're seeing resistance mutations occurring in these patients. Now, what my lab has focused on is how do we take this a step forward and try to apply some of the chemistry here and some of the insights about p53 towards more p53 mutations or compounds that could in principle target many more p53 mutations. And so what we engineered in recent work is a small molecule based on the scaffold reported in the New England Journal that then drags in a toxin. So rather than reactivating p53, you're repurposing it to have a gain of function toxic mechanism as the p53 protein sort of accumulates in these cancer cells, and you use it as a hook to drag molecule in.
Wow, that's exciting. And if elephants have a lot of copies, why don't we just make a lot of copies like elephants do with some kind of gene editing? Is that a mechanism?
So yeah, what you're suggesting is people have tried gene therapy for p53 in the past. They reasoned that if you've lost the p53 protein expression in these tumors, maybe you can just replace it with a viral gene therapy. And to make a long story short, none of that has worked, and in large part because I think for two reasons. One is that many of the p53 mutations that occur in patients are dominant negative. So if you give more p53, it actually doesn't help at all. And the second reason is that we just have never been able to deliver gene therapy to most cancer cells, and we need to deliver to 100% of the cancer cells to be successful.
I see. Great. Well, it's a great start. Every long journey begins with the first step. This sounds like it was an important first step, saying that there's a path. Sounds like you're trying to walk down that path, as I'm sure many others will. Thanks for taking time out on a Friday, and thanks for sharing what you're doing.
Thank you.